Hello everyone, welcome back to our channel. I'm Dr. Komal, Cosmetologist and Trichologist and associated with Trisamya Center for Photomedicine. Today we are going to talk about how light-based devices like photomedicine can help with the scalp's vitality and support the natural regeneration of the hair and deal with the current problems we are facing with hair loss. And with us is the visionary behind all this, Dr. Shakti Upadhyay. So let's begin. So Dr. Shakti, for most of us, hair is only there for cosmetic or beauty purposes. Do we even have a scientific reason behind having hair?
Sure. For most people, hair is for beauty. In fact, that's what people go for. But if I have to explain in a very general terms, just like we have a screen protector for your mobile because it houses a very expensive processor.
Right.
Same way, hair also protects our brain which is a very important organ of our body. So it provides a kind of physical protection. But besides that, hair also provides multiple other benefits. For example, it protects against heat because if heat and UV light from the sun. And it also provides protection against dryness because with the heat, if the scalp is dry, then it could cause damage to the hair. And third could be, which is also very important, is the sensory function because the hair root has a lot of nerve endings. So as soon as some hair is touched, in fact, you get the sensation for that. So it's kind of a sensory perception as well.
So Dr. Shakti, you mean to say that hair is the nature's stylish security system for the brain?
Absolutely, that's correct.
So in today's time, hair fall has become extremely common. Dr. Shakti, why do you think as we age, the hair starts to thin or fall? And what causes hair loss?
Well, the hair loss actually reflects the changes in the hair ecosystem. There are both reasons, both aging as well as lifestyle changes. So as we age, we know that our cells also undergo changes because every cell has a finite lifespan. After it is born, it stays functional for some time and then undergoes degeneration. Same way, the hair follicles also have that aging process. So therefore, as we age, so hair follicles, they stop producing or gradually they reduce production of the ingredients that is required for the synthesis or the formation of the hair shaft. So therefore, the hair fall starts happening as we age. But there are other reasons also because during aging process, there is also a lack of sebum production that causes also the dryness of the scalp. There is also less vascularity. So if the blood vessels, they don't supply enough sufficient blood, then it also causes a lack of nutrients and the hair follicle cannot survive. So these are the common reasons why hair fall. There are other reasons, that is because of the lifestyle, because we go out in the sun, we use a lot of chemicals in our cosmetics with the shampoo and then the hair oils. And also we treat our hair with different kind of techniques. So all these things make the difference. Additionally, it also depends on the nutrition. If our nutrition is not balanced, that also will cause hair loss. Right. Then the third reason, which is very, very important in present day context, is the stress. People who go through stress, there are hormonal changes. True. And because of that, there is also hair loss.
So Dr. Shakti, do you think the human hair behaves like plant growth?
Well, indeed, it's true to some extent because just like an infertile soil, even though you may have a seed, but the seed will not germinate if there is not enough water, if not there is a fertilizer, but there is no sunlight. So same way, if our scalp, although has a hair follicle, but there is no nutrition, there are infections or there are for other reasons, very harsh chemicals that we are using. So therefore, it also affects the seed, which is the follicle, and it affects the growth of the hair. So you can certainly compare our hair growth just like a plant growth on an infertile soil.
So we conclude that our hair behaves like a plant growth if we have a fertile and a good healthy scalp.
Sure, that's correct.
So Dr. Shakti, what are the current methods of hair regrowth?
Well, that question should be asked to you because you are the practitioner, you are the doctor. So I would ask you in return this question. Why don't you explain to the audience that what are the currently used methods?
Surely. So basically, hair regrowth falls into 4 major groups of treatment. First, starting with topical serums like Minoxidil. They are good enough when you start using it, but once you stop, the hair fall starts again. Then are the oral supplementation, but they work only if you have nutritional deficiencies. Then comes the injectables like PRP. They deliver hair growth but are again invasive. And hair transplantation, which is surgically implanting the follicles, but the success of it also depends on a good healthy scalp.
Sure.
So most of these methods have their own place, but they don't really help the scalp ecosystem internally.
So they have their own limitation. Most of this,
Yes.
they have certain limitations, each one of them.
Yes.
Although they are very effective, but they have limitations.
Yes, surely. So Dr. Shakti, what do you think could be the other alternatives to promote hair regrowth?
Well, we have developed a technology which is called photobiomodulation therapy, and which works wonderfully for hair regeneration and hair growth.
So Dr. Shakti, how can photobiomodulation developed by you can help in promoting hair growth, and can you explain the mechanism of it?
Well, if you recall, I have spoken about photobiomodulation therapy in my previous videos, where I explained that we use light energy to modulate the biological system. That means we can change the biological system, we can enhance or we can reduce as per the requirement. Now, in the context of the hair, the same photobiomodulation therapy can be used, and it works through multiple mechanisms. It actually creates a biological environment where the hair can grow very easily. Well, as I said, the photobiomodulation therapy has multiple functions. Actually, it acts through multiple mechanisms, I should say. First one is, for example, it enhances the blood supply. It's a vasodilator. It expands the blood vessels so that there is more blood supply to the hair follicle, and the blood supply brings more nutrition. So that helps the hair to grow.
Right.
Secondly, it also activates the stem cell in the hair follicles to produce growth factors. So we don't have to give growth factors from outside, just like you described earlier, that you inject growth factors or PRP. But here, with the photo energy only, you activate the follicles to produce growth factors, and which help in the hair growth. Thirdly, as I said, that this is also acts through the immune system. It enhances the immunity, scalp immunity. And because of the scalp immunity is enhanced, there are chances of getting infection in the scalp is low. Because if there are infections, these fungal infection or bacterial infection, they also compete with the hair follicles in terms of nutrition. And because the infectious organism, they are more powerful. So therefore, there is a less supply of nutrients to the hair follicles, and the hair starts falling because of, as we know, because of dandruff and other kind of infections. So that way, this photobiomodulation therapy acts at multiple levels. So this is the beauty of this, that without using any external medicine or being an invasive process, we can just with the photo energy, we can have the therapeutic effects. So we can regrow the hair, and we can enhance the follicular process, folliculogenesis, to maintain the hair growth.
So by that, Dr. Shakti, if you have said that it works on the immunomodulation of the scalp, can we say that serious hair conditions, autoimmune conditions like scalp psoriasis, alopecia areata can be treated with photobiomodulation without using any steroids?
Absolutely, because that is the principle on which this photobiomodulation therapy works. Because you can, depending on what frequency of photo energy you're using, you can either enhance immunological responsiveness or you can reduce it. In the cases that the condition that you describe, here the immune system is causing the damage. So what we need to do is to downregulate or downplay the immunological mechanisms. So that can be done with a certain frequency combinations, and we can have a therapeutic effect without using steroids.
So Dr. Shakti, can we decrease the inflammation in cases like scalp psoriasis and actually increase the healing capacity of the scalp to get nourished?
Absolutely, because as you said, the inflammation, that process itself is an immunological mechanism. So using the immunomodulatory technology, we can actually regulate the inflammatory process, which is to the extent that we can use it for tissue healing process without causing any damage to the scalp. And that's how it works. And all these conditions, we can have actually the therapeutic benefits and also enhance the immunity of the scalp, which can further protect scalp against a variety of other infections as well.
So I guess we have a breakthrough in the conditions of autoimmune diseases that are causing severe hair loss in patients, and they don't have any other mechanism to treat it other than steroids and immunosuppressants, right?
Absolutely, because steroids and immunosuppressants, although they work, but they have other side effects. Whereas this photoimmunomodulation therapy does not have any side effects. It's completely non-invasive. So that is the biggest advantage that we have.
So Dr. Shakti, in severe cases of hair loss and baldness, we advise the patient to get hair transplantation. But even after getting hair transplantation, the patients start to lose hair, and it can be a huge investment for them. Can photobiomodulation help with that?
Well, as you described, that there are certain conditions, the only option left is the hair transplantation. Because as we discussed earlier, if there is no hair follicle, there cannot be any hair growth. So most of this baldness and this thing, that actually the hair follicle is lost. They are completely degenerated.
Right.
So in those cases, we need to transplant the hair follicles from the dense area. And once you transplant the hair follicle, you require also a biological support system. Just give you an example. For example, in a desert, if you plant a seed and if you do not support the ground, there will be no plant growth. Similarly, after transplantation, what it requires is the blood supply immediately to be restored.
Right.
And also all the growth factors which are locally produced, that needs to be provided. So otherwise this hair will not survive, it will fall off, and that will be too expensive from a patient's perspective. So in that case, what we propose that after hair transplantation, if we apply or if we offer this photobiomodulation therapy, then it can enhance first the blood supply, so it brings nutrients. It also triggers the production of growth factors, which will enhance the hair growth, and also it will have effect on the immunity, so there is no infections or anything like that. So there are chances of hair fall or hair loss is much reduced, and that way the patient could benefit if they use post-transplantation on a regular basis our photobiomodulation therapy.
So Dr. Shakti, I feel that most of the hair transplant surgeons can actually enhance their results for the patient with photobiomodulation technique, and plus it is non-invasive and can really benefit the patient in long term to actually restore their hair and not have the hair loss back again, right?
Absolutely, you're right.
So Dr. Shakti, as you have spoken about immunomodulation, can it really help autoimmune conditions like scalp psoriasis and skin psoriasis, because there are so many patients suffering from it and we get such cases on a daily basis?
Absolutely, because this is a very, very interesting topic and very important topic. And we would like to cover this in a next video. So please stay tuned.
And please subscribe.